So what patient experience technology is moving the needle the most right now, in your opinion?
Well, we think telehealth has a huge opportunity to help people who are dealing with complex conditions access specialists. If you look at the disconnect, I mean, the gap, there's 80% of rural residents don't have access to specialty care. We found that people have dealt with complex medical conditions based on our survey that less than half of them have taken advantage of a virtual second opinion. And we found that time, cost, and other variables are getting in the way. So we're trying to make sure we reduce that gap and provide better access to the expertise people need.
It's interesting, and it may seem, somewhat surprising that I'm going to say this, but it's really alerts and reminders coming from SMS and other secure messaging. Those things have been around for a long time, but I think we've hit a groundswell where the majority of the patient population feels comfortable being alerted to those things. So if they're missing paperwork related to a visit, if they need reminders about their discharge instructions or taking their medications, if they get alerted that somebody canceled an appointment and now they can move up their dermatology appointment, a couple of weeks because an opening's been made available. All those things are happening. And it's definitely getting to be a tool that patients are appreciating. I think the next step is to be able to then integrate that with AI to start delivering the alerts at a time that a patient's most likely to be looking at their phone or have access to their phone, then maybe delivering it at an inconvenient time. I think you'll see that in the coming months and year.
So for us, this is the reason why we acquired UScript, was really to enhance the vertical integration of the clinical decision support tools that UScript brings to the table, and to be able to bring that to the point of care for the clinician and where we are today, and better to serve the needs in solving the PGX end-to-end technologies.
So obviously there's a whole lot of patient-facing, patient engagement tools happening at the moment. One thing that really resonates with us, and a lot of discussion here at Vive, has been around how do we free up the clinician to spend more time with the patient, which ultimately means they have a better experience as a patient. So we think about how do we give them tools that make the doctors spend less time in administration. So good communication tools is a good example of that. And that means ultimately the patient has a better experience because they spend a lot more time with the clinician face to face.
Yeah, so especially focusing on that in-room experience, what we've noticed with Linkata is that organizations are, from a digital front door perspective, are focused both before the visit as well as after the visit, but they're really missing that in-room connection. So we've been speaking to a lot of health systems while we've been here at Vive, and they also agree that that in-room connection is missing, and 65% of the patient are visual learners. And in that in-room, which is really just a billboard that's available for them to, from a marketing perspective, as well as building loyalty, patients spend about 85% of their waking hours looking at the TV. So that's really a captive audience that they can use to, again, educate the patient to improve outcomes, but then also utilize that as a marketing opportunity to showcase their vertical services and really win them over from a loyalty perspective.
So the days of paper prescriptions are mostly gone, right? And so there's e-prescribing today, and that's great because it lets you, say, I'm going to send a prescription to a pharmacy and you go show up. But what happened is you remove all control from the patient at that point. You discover everything at the pharmacy. It's a huge problem for you, and it's a huge burden for pharmacists. So what we've done is created the digital prescription. It lands within seconds of the doctor writing a prescription electronically on your phone. We search all pharmacies around. We bring benefit price, cash price. We bring coupons. We know if there's a PA. They give you all the information so you can have a value conversation with your doctor right then. You don't discover $200 worth of medications are needed the first time you get type 2 diabetes at the pharmacy. You discover it at the doctor's office. Say, hey doc, this is $200. Remind me again why I need to take this? And maybe there's an alternative that's cheaper. We can give that information together with the doctor, and it creates a different experience for patients. And so that digital prescription is something, and I think using a prescription as a vehicle to improve health, not just as something you send to a pharmacy, is empowering for physicians and patients as well.
Yeah, the most important, especially in our populations, is to not change behavior at all, right? And so how we do that is through this device right here. And this is a device that measures respiratory rate, heart rate, and activity continuously, thousands of breaths per day. Wow. And it actually adheres to the inside of a patient's undergarments. So underwear, bra, it has about a 1 year shelf life. So you do not need to do any recharging. It goes in the undergarments, and it can be put through the washer and the dryer. So the patient sets it and forgets it. And so that's what we wanted to do, is make it as easy as possible. There's no charging, there's no putting by the bedside and putting on and off, etc. You get a set of 8 of these, you put them on your undergarments and you forget it, and it's continuously monitoring your heart rate and your respiration rate and helping to identify whether you're gonna have an exacerbation and be hospitalized. And again, our research is showing that we can significantly improve the experience for not only the patients, but also the providers in helping to reduce these events by monitoring them effectively.
So I think kind of along those lines of what we'll be talking about on stage with UC Davis is how can we better extend access, and not just access into the patient's home and within the service centers for the hospitals, but what about non-traditional settings, banks, grocery stores? How can we get, virtual kiosks, if you will, just any avenue to extend access and just more engaged, from passive engagement to active patient monitoring. I think all of those are some really exciting areas.
In my opinion, I do believe it's telehealth. Telehealth obviously gained a lot of traction in 2020 after the pandemic, and probably up until 2022, 2023. But now that we've actually seen patients buying into it more, especially in the rural communities, where if you do have a routine examination or routine follow-up, with a doctor, you don't need to drive the 50, 60 miles. You can actually just get on the video. Now, with that, there are going to be some challenges with that. I sometimes think that we forget that on the patient side, we're not providing enough resources for the patient. We always assume that everyone's got unlimited data. They have a smartphone. So I think it's our duty as healthcare leaders to make sure that our patients, have those resources for them. So even though telehealth kind of went away the last couple of years, I feel like it's going to go back up in 2024.
Definitely. Well, thank you for being here with us today.
Thank you for having me. Much appreciated.